Common load-based adaptations in people with Achilles tendinopathy.
Hello, I'm Ruth Comenti, a physical therapist and researcher at the University of Iowa. Most of my work has focused on understanding tendon pain, and in this video I'll talk about some of the common questions that I hear from patients with Achilles tendinopathy. One of the first questions I get from patients is, why is my tendon so swollen? Tendons get bigger when you load them, so a thicker tendon simply tells us that you've loaded that tendon. And a key thing to know is that the size of the tendon is not related to how much pain you'll have. A related question, particularly from people who've had an ultrasound or MRI, is, what does degeneration mean? When it comes to imaging, the term degeneration usually just means it doesn't look perfect anymore. We have these advanced imaging techniques that allow us to view the tissues inside the body, but when interpreting these images, we have to put them in the same context and with the same expectations that you have for tissues on the outside of the body. None of us would expect for our skin to look the same as it did 20 years ago, and that's okay. We change as we live, and one of the most amazing properties of our body is its ability to adapt. As I'd mentioned before, tendons adapt to load by getting thicker. Think how remarkable that really is. Imagine a car that had tires that got thicker the more you drove around. There are so many people walking around with tendons that show signs of this load-based adaptation, sometimes called degeneration, but they have absolutely no pain. In fact, up to 35% of people who have no tendon pain have these same signs of tendon degeneration on imaging. If you have a thickened tendon, or have been told that you have extensive tendon degeneration, the good news is that when we look at all the data that's out there, we can conclude that the magnitude of these changes in the tendon doesn't relate very well to the magnitude of the pain.
Another common question, particularly from patients with insertional Achilles tendinopathy, is, does having a bone spur or calcification impact my ability to benefit from physical therapy?
The idea of a bone spur in your tendon can be pretty frightening, and it's really this idea which is why we hate having it there.
But a bone spur or calcification doesn't indicate there's anything wrong with the tendon, but instead shows that the tendon has adapted to load by growing some tougher tissue, bone.
All tissues, including bone, muscle, and tendon, respond to the loads that are placed on them. If you gradually increase the level of loading on the tendon, then it adapts and becomes stronger. These areas of bone can look scary and a bit like a spur on X-ray, but the bony bit is sitting inside tough tendons and is highly integrated within the tendon. Patients often worry about bone in their tendon, but as a physical therapist, I just see it as a sign of adaptation. The cells in your tendon respond to the tension and compression by making bone tissue instead of tendon tissue. This is your body's way of making the tendon better able to respond to that combination of loading. Here's another fact that you might find surprising. Having this bony adaptation does not mean that you will have pain. Many people without pain have this bony adaptation. They are almost as common in non-painful tendons as they are on painful ones. Again, as a physical therapist, I don't worry about these bony adaptations because they don't change the exercises that I would give you. They were probably there before your pain started, and they'll be there long after you're back to doing the activities that you love. And the last question I wanted to address is, does Haglund's deformity cause Achilles tendinopathy pain? Let's do a quick review of the anatomy. The Achilles tendon connects your calf muscles onto your heel bone, which is how your calf muscles move your ankle. The part of the heel bone right above where the tendon attaches is often called a Haglund's deformity, and it varies in size between people. However, you should note there's no correlation between the size of the Haglunds and the presence of Achilles tendinopathy pain. The larger the Haglunds, the greater the mechanical advantage you get out of the calf muscles. As you move your ankle so that your shin comes over your foot, the back of the heel bone can contribute to a lever arm for the tendon. The larger your Haglunds, the greater the mechanical advantage of the system, allowing you to get more work done while applying less force, which is pretty nice. Yet the size of the Haglunds combined with how you move does relate to the amount of compression there is on the tendon. The further you move your shin over your foot, the greater compression you will get as well. And this happens in everyone, regardless of the size of the Haglunds. This compression can contribute to pain, so it's sometimes pain relieving to temporarily reduce how much compression there is on the tendon. The easy way we can do this is by reducing how much your ankle moves. You can modify how you do some things for a while to give your tendon a breather, or you can wear heel lifts. In this video, I have described how Achilles tendinopathy is associated with changes within and around the tendon. I've explained that tendon degeneration and bone spurs are often described as pathology, but they're really just indicators that the tissues have adapted to the loads that have been placed on them. Also, a Haglund's is commonly described as a deformity, but from a biomechanics perspective, it's a sign of how your body has developed a lever to allow the muscles to work more efficiently. One goal of the home exercise program is to give you control over what types of loading you place on your tendon, which will both promote good adaptation and reduce pain.